Good day everyone, I am Jeric D. Valdez, a student from BSIT 1D. Our topic is about gene therapy. Gene therapy is a technique that utilizes genes to treat or prevent disease. Gene therapy involves inserting genes into a person's cells with the purpose of providing treatment for a certain ailment. Generally, a health and normal gene is implanted into a cell or tissue to substitute an abnormal gene and which causes diseases. There are techniques in order to deliver the gene, which may be difficult and require some vectors like to carry the normal gene into the cell. With future endeavors along this field, such technique may be used by doctors as an alternative of using drugs or surgery. Gene therapy is a technique that uses genes to treat or prevent disease by inserting a healthy gene into a person's cells to replace an abnormal one. There are three main approaches to gene therapy. Number one is replacing an altered gene that caused disease with a healthy copy. Number two is inactivating or knocking out a mutated gene that functioned improperly. Number three is introducing a new gene to help the body fight a disease.
Everyone, my name is Genesis Tapni Birimando from BSIT 1D, and our topic are gene therapy. Gene therapy and stem cells. Stem cells hold great potential in gene therapies. Stem cells are unique cells with the capacity of self-renew and differentiate into specialized cells, making them valuable for gene therapy. Self-renewal is essential to maintain a continuous supply of cells, while differentiation is crucial for replacing specialized cells that are damaged, used up, or died through a person's life. Hematopoietic stem cells, which can be easily obtained from blood, bone marrow, or the umbilical cord, are highlighted as a good choice for that purpose. Stem cells is gene therapy. Stem cells are valuable for gene therapy due to their ability to self-renew. Hematopoietic stem cells are a preferred choice because they can be easily sourced from blood, bone marrow, or a umbilical cord. Stem cells are unique because they possess two main abilities. The one abilities are self-renewal. They can make copies of themselves to maintain a constant supply. And differentiation. They can develop into two types of specialized cells such as blood, nerve, or muscle cells. Importance of self-renewal and differentiation. These two processes are crucial for the body. Self-renewal ensures a continuous flow of the stem cells, while differentiation allows them to replace specialized cells that become damaged, used up, or die throughout a person's life.
Stem cells jargons. Potency refers to the number of possible fates that a cell could acquire. Totipotent. A cell that can become any cell type, including the placenta. Multipotent or pluripotent. A cell that can become many but not all cell types. Bipotent or unipotent. A cell that can become one or two specific cell types. Terminologies such as pluripotent and multipotent are used by scientists to aid them in describing the stem cells. Some stem cells can make more kinds of specialized cells than others, though all stem cells can both self-renew and differentiate. The term totipotent means that the cell can differentiate into all types of specialized cells in the body plus cells that are necessary during development of the embryo. Placenta, yolk sac, umbilical cord. Unipotent is used to describe cells that can only differentiate into one type of specialized cells. Spermatogonial stem cells are unipotent because they can only form the spermatozoa. Types of stem cells. Number 1 is embryonic stem cells. Embryonic stem cells are obtained from a blastocyst, which is a very early stage embryo. A blastocyst is a ball of about 50 to 100 cells that has not yet embedded in the womb. It is composed of an inner cell mass, an outer layer of cells, and a fluid-filled space. The inner cell mass is the group of cells from which embryonic stem cells are derived. ESCs are considered promising because they are pluripotent, meaning they can develop into all different types of cells in the body. Facts about embryonic stem cells. Number 1, they are extracted from frozen embryos that are left over from in vitro fertilization. These embryos can be stored for 10 years or more. Number 2, they grow out of ESC lines. Number 3, each line of ESCs has a unique potencies. Disadvantages associated with the type of cell, likely embryonic stem cells. Difficult to culture and slow growth. Embryonic stem cells are difficult to culture in a laboratory and have a slow growth rate. Abnormal karyotypes. The cells have a tendency to develop abnormal numbers or structures of chromosomes. Potential to form teratomas. If not all cells have differentiated into the desired cells type before being transplanted, they can form teratomas, which are tumors containing a mix of different tissue types. Ethical controversy. The use of these cells is a subject of ethical debate, often due to their origin. Stem cell therapy using embryonic stem obtained from the inner cell mass of the blastocyst. This illustrates the beginning with fertilization to form a fertilized egg. This egg develops into a morula and then a blastocyst. The inner cell mass of the blastocyst is extracted and cultured to obtain embryonic stem cells. These ES cells differentiated into specialized cells like neurons, liver cells, and blood cells. These differentiated cells are transplanted into patients to treat conditions such as diabetes, Alzheimer's, and cardiovascular disease, showcasing stem cells' potential to repair damaged tissues.
Adult stem cells, CS or tissue stem cells, can often make several kinds of specialized cells, but they are more limited than embryonic stem cells. Adult stem cells are considered multipotent because they can become multiple types of specialized cells, but not all the kind of cells in your body. Induced pluripotent stem cells, iPSCs. Induced pluripotent stem cells are adult cells that have been genetically reprogrammed to behave like embryonic stem cells, like ESCs. iPSCs are pluripotent, meaning that they develop into any type of cells in the body. This reprogramming process involves introducing specific genes into the adult cells. Similar to changing a computer program, researchers believe that iPSCs could potentially be used in the future to treat diseases such as Parkinson and Alzheimer's. Number 4. Umbilical cord stem cells. Stem cells can be obtained postnatally from the umbilical cord, including the umbilical cord blood cells, amnion, placentia, umbilical cord vein, or umbilical cord matrix cells. This source is readily available and inexpensive, which are multipotent and are capable of forming many different cell types. Donated cord blood that meets requirements is frozen and stored at cord blood bank for future use. 10 years. Overall, there are benefits and challenges to the use of embryony. Adult-induced pluripotent and umbilical cord stem cells used in gene therapies. Though there are still a lot of ethical controversies regarding this source where stem cells are obtained and the technique precise. There are precise endeavors and researchers conducted to establish the potential of stem cells for treating disease and prolonging life.
I'm Junel Padilla from DIMSU MLOC BSIT 1D. In vitro. So, what is in vitro? The term in vitro comes from the Latin in vitro. It refers to a medical study or experiment that is done in the laboratory within the confines of a test tubes or laboratory dish.
In vitro fertilization, also called IVF, is a complex series of procedures that can lead to a pregnancy. It's a treatment for infertility, a conditioning in which you can get pregnant after at least a year of trying for most couples. IVF also can be used to prevent passing a genetic problems to a child. During in vitro fertilization, mature eggs are collected from the ovaries and fertilized by sperm in a lab. Then a procedure is done to place one or more of the fertilized eggs, called embryos, in a uterus, which is where babies develop. One full cycle of IVF takes about 2 to 3 weeks. Why it's done? IVF is offered as a main treatment for infertility in people over the age of 40. It also can be done if you have a certain health conditions. For example, IVF may be an option if you or your partner has 1. Fallopian tube damage or blockage. 2. Ovulation disorders. 3. Previous surgery to prevent pregnancy. 4. Issues with sperm. 5. A genetic disorder. There are also risks of having in vitro fertilization. IVF raises the chances of certain health problems. From short-term to long-term, these risks include stress, ovarian hyperstimulation syndrome, miscarriage, multiple pregnancy, premature delivery and low birth weight, and cancer.
Everyone, my name is Mark Christian Esimora from Fertility Book London. I am 19 years old. How you prepare yourself and how you can bet your fertilization? To get started you want to find a reputable fertility clinic if you live in the United States. The Center for Disease Control and Prevention and the Society for Assisted Reproductive Technology provide information online about clinic individual pregnancy and live birth weights. Before you start a cycle of IVF, using your out eggs and sperm, you and your partner will likely need various screening tests. This includes ovarian reserve testing, semen analysis, infection disease screening, practice and blood transfer, uterine exam. What to expect? After the preparation are complete, one cycle of IVF can take about 2 to 3 weeks. More than one cycle baby needs. After procedure, after the embryo transfer, you can get back to your usual daily routine. Your ovaries may still be enlarged, so vigorous activities or sex might cause discomfort. Result: at easy 12 days after eggs retrieval, you get a blood test to find out whether you're pregnant. If you're pregnant, you likely be referring to an obstetrician or other pregnancy, especially for prenatal care. If you're not pregnant, you stop taking progesterone and likely get your period within a week. For your care team, if you don't get your period, or if you have unusual bleeding, if you like to try another cycle of IVF, your care team might suggest steps you can take to improve your chance of getting pregnant next time.
Hello guys, my name is Paul Vincent Ruiz from BSIT 1B, and for our topic for today is surrogacy. So first of all, what is surrogacy? Surrogacy. Surrogacy arrangements are medically, emotionally, financially, and also legally complex. For some people who previously were unable to have children, including gay couples and women who are unable to carry pregnancy, surrogacy offers opportunity to have child. Types of surrogacy. The traditional surrogacy. In this type, the surrogate uses her own egg, which is fertilized by the intended father's sperms. Through artificial insemination, the surrogate is the child's biological mother. And also, gestational surrogacy. This is the more common form today, utilizing IVF, an embryo created from the intended mother's or a donor's egg, and the intended father's or a donor's sperm implanted into the surrogate's uterus. The gestational surrogate has no genetic link to the child. And also the surrogate. A surrogate, sometimes also called as gestational carrier, is a woman who convinces, carries, and gives birth to a child for another person or couple, intended parents. The surrogate agrees to give the child to that person or a couple after the birth.
My name is Joshua Nilo from BSIT 1D.
This is the reason for surrogacy. A surrogacy arrangement may be considered if a woman is unable to become pregnant or carry a pregnancy because she has had a hysterectomy or missing part of her uterus, ovaries, or another part of the genital tract. A woman has health conditions that make pregnancy dangerous. A same-sex male couple wish to have a child using the sperm of one or another partner. A single man wishes to have child using sperm. A woman who has frozen embryos to storage dies and her male partner wishes to use the embryos to have child. Things to consider before entering a surrogacy arrangement. There are many medical, emotional, financial, and legal issues to consider when entering a surrogacy arrangement. There are also matters to be aware of once the surrogate gives birth and gives the child to the intended parents. Key factors for a successful surrogacy arrangement. Factors can contribute to a positive surrogacy arrangement include all parties being in good mental and physical health, clear and open communication between all parties, having realistic expectation about the chance of a successful outcome, all parties having a good understanding of medical processes involved, being prepared for emotional responses and reactions that can occur during the process, being aware and prepared for the financial costs involved, agreement between parties on how the pregnancy and birth will be managed,